Welcome. I'm Deborah Sharu, founder of Practitioner Development UK. We provide quality professional development courses for nurses and allied health professionals. The video clip you are about to see is a sample of the sort of training we offer on our musculoskeletal and minor injury programs. This is one of the many courses that we provide. For further information, go to our website, www.pduk.net. Thank you.
We're going to examine the knee, and for this your patient needs to be lying on a trolley or on a bed. We start by looking generally at the knee, any swelling, any bruises, any redness, and for this the patient needs to have the whole of the legs exposed. We start by going to the foot of the bed. I'm going to ask the patient to bring their feet up towards them like this. Now I'm going to get you to relax your feet. I'm going to feel the pedal pulses. And now I'm going to look at the knees themselves from this perspective, looking at the bony contours, looking for any swelling, and just seeing if the knees are symmetrical. We now move to the side of the patient and to the affected leg to be examined. I'm going to start with the leg in extension, and what I'm going to do is ask the patient to push both of their legs down onto the couch and bring their feet towards them, so we're tightening up the quads muscles. If you have a feel of the quads muscles, you can feel if they seem the same sort of amount of tension in them, or if one of them feels quite soft, as if it's underused. Okay, you can relax. I'm now going to ask you to lift your legs straight off of the bed. Thank you, and down. If your patient is elderly or unable to do this, you may want to just support the foot and bring it from the bed, and then just ask the patient to take the weight from your hand. The straight leg raise demonstrates the whole of the extensor mechanism and is a really integral part of the knee examination. I'm now going to ask you to bend your knee as much as you can. If the patient needs assistance with this, you can help them. This demonstrates to me how well the hamstring muscles are working and the amount of flexion they have in their knee. I'm now going to get you to put your knee at 90 degrees because this is the second position in which we examine the knee. From this position, I will stand in front of the knee, and I'm going to again be looking at areas of the knee and also palpating areas of the knee. So I'm going to start by feeling along the tibia, over the tibial tuberosity. We carry on up until we reach a soft area. This is the patellar tendon. If we go laterally, I'm putting my thumb into what we call the lateral joint space, and then we come medially into the medial joint space. Any pain here can indicate a problem with the meniscus. We're then going to carry on up and around the actual patella itself, seeing if there's any pain on palpating it this way. From the top of the knee, we're going to go sideways, medially and laterally, and we're going to palpate the femoral condyle, the medial femoral condyle here and the lateral femoral condyle on this side. The last thing I'm going to palpate is the fibular head, which is located around here. The examination that I do for the special structures in this position is that of a posterior draw test, and for this I'm going to put my fingers over the top of the knee, and I'm going to put the heel of my hand against the tibial tuberosity, and then I'm just going to push with much of a wrist action rather than shoulder and see how much movement there is. From this position we're going to move down to about 30 degrees of flexion, and this is usually easier done if you have something supporting the knee. You can either use a pillow or you can use your own knee if you're flexible enough to do that. So for this I'm going to put my knee up on the bed and ask the patient to rest their leg across my leg. By doing this they switch off the quads muscles and they're now quite relaxed. In this position we're going to do 3 tests. The first of the tests is called the Lachman's test, and this is testing the anterior cruciate ligament. So for this I'm going to put my hand underneath. I'm going to firmly hold the patella and upper leg so it doesn't move, and I'm going to draw the tibia forward on the femur. It's a very subtle move and you don't see a huge amount of movement, but you can often just feel a little bit of movement here. If there's damage, there may be a great deal of laxity on doing this. The next test we're going to do, going to keep the hand in exactly the same position. We are going to do the valgus test, which is stressing the medial collateral ligament here. And for this, I'm going to just lift the heel off the bed a little bit, ask the patient to relax and just let me move. And for this, I'm going to now pull the ankle towards me, so we're opening up the knee joint medially. We'll return to the natural position, and then we're going to do the opposite, which is the varus, which is opening up the lateral joint space here, testing the lateral collateral ligament. There shouldn't be a huge amount of movement on either of those two. I'm now going to let your leg come down, and we're going to put it into an extended position again. I'm just going to have a little feel around the kneecap and see how mobile it is and if that causes any pain to the patient. And if there is any swelling there, then I will palpate the swelling and just see where the actual swelling is, whether it's inside the joint causing an effusion, or if it's external to the joint, is such a thing like a bursitis, where it may be across the top of the knee or actually below the knee. The last thing I will do is just passively bring the knee into extension and see if this elicits any pain. If it does, it's generally a sign that you have inflammation of the actual synovium of the knee joint and that there is an inflammatory process going on.